This computer. Hello and welcome to tonight's webinar. This is You Cannot Fix What You Can't See. So tonight we'll be diving into our to understanding how continuous glucose monitors work and a little bit of insulin resistance. So it's not about blame or perfection, but tonight is about why most people aren't failing, but they're just flying blind. We don't know what's really on inside of our body. So let us dive right in so that we can just work over a few slides. And from there, we'll ask questions later on. We have a testimony. But we're going to dive right in. Let's see. We're going to go into presentation mode. Oops, I'm sorry. Bring me down here. We're going to present. So this is, we'll be talking a little bit about biometrics. That just means what's happening inside of your body. And if you've been struggling with fatigue, inflammation, blood sugar issues, or you want a clearer picture of your metabolic health, what's actually happening on the inside, then this session is for you. So I'm TaShawn. I am a registered nurse. I've been a registered nurse for over 20 years, and I've been providing private coaching focusing on metabolic health and insulin resistance. I've authored 2 books. One is Uproot the Cravings and Sugar Deception. Both are available on Amazon. I am passionate about helping people make informed healthcare decisions. My goal is to reverse 1 million type 2 diabetes in my lifetime or more. So tonight we're going to understand insulin resistance, the impact on health and how in the bigger picture. Insulin resistance occurs when the body cells, particularly the ones in muscle, fat, and the liver, become less responsive to insulin. It's a hormone that facilitates the uptake of glucose from the bloodstream into the cells for energy. As a result, the pancreas compensates by producing more insulin to maintain normal blood sugar levels. Over time, this increased demand on the pancreas can lead to elevated blood sugars and may progress to prediabetes or type 2 diabetes. So insulin resistance doesn't just happen overnight. It develops quietly long before diabetes, like 10 to 20 years. The body compensates until it can't. By the time the lab changes, the body has been already struggling for years. So just giving us a picture of these things. And so the cycle is we eat the food, and then our body makes insulin, which is a normal hormone. Hormones are meant to come in and go out. They're meant to have rest breaks, but because we consume so many carbohydrates and sweets, the body just never has time. This particular hormone never has time to take a break. And so what we're doing is just learning this cycle. So the body makes the insulin, the cells begin to resist the insulin, and when it happens, it stores the sugar as fat. And then we get tired, but the cravings still go on, and it's just a vicious cycle. So some of the signs and symptoms of insulin resistance, as you can see here, is acne. A lot of people don't know skin tags. I have a story about a skin tag that was like under my arm and eating too much sugar. And then all of a sudden, I decrease the sugar, carbohydrates. Sometimes when I don't do right, 99% of the time I do. I think around Christmas time, I may have too many cookies or something like that. Or just some things that are supposed to be like low carb, low sugar, and I did not know. And so sometimes, I get some of these symptoms again. So skin tags, but after reducing it down to nothing again, I look and the skin tag is gone. It's amazing. It's for real. You can tell if you have something with insulin resistance with the belly fat. high triglycerides, high blood sugar, tired after meals, weight gain, gout, decreased testosterone, PCOS, fatty liver, cravings for sweet, hair loss, low blood sugar, and the list goes on and on. So some of the diagnoses could be prediabetes, type 1 diabetes is your pancreas, you are not producing insulin. So type 2 diabetes, type 3 diabetes, which is the reason why I started, because I was losing my memory in my 30s, and I found out that insulin resist or that dementia could be considered type 3 diabetes. And so this is how I started my whole journey. Even gestational diabetes, cancer, all of these things, fatty liver, Alzheimer's, neuropathy, blindness, kidney failure. There's so much to know, but these are some of the effects or some of the diagnoses you might see if you possibly have a problem with insulin resistance. Again, the symptoms are you crave salty or sweet foods, you get tired. A sign that many of us know for diabetes who are already diabetic, it's three symptoms: polyuria, polydipsia, and polyphagia. Means always hungry, always thirsty, and always urinating. So if you're starting to use the bathroom more at night, you may want to check, some of your lab levels, go to the doctor, and we'll talk about what some of those levels you may need to be aware of. This tingling sensation in the feet and in the hands. The reason why is because your body is always going to choose to take the good oxygenated blood and use it for your vital organs like your heart, your lungs, your kidneys, all those things before it feeds like the extremities, because if so we have this sweet glycated sugar, and the body's like, okay, we're going to use the good stuff for the vital organs first. And our hands and our feet aren't as important because we don't need them to live. And so if you put in a picture together, that's kind of how people lose their feet, and their may get a sore, and that sore leads to getting their foot cut off, and so forth and so on. I used to work at the VA for 12 years, and surprisingly, I thought that all of the people there, with their feet cut off and everything, was there because of their feet were cut off because of the wars and stuff. And it wasn't until I got in there as a nurse that I learned that 99% was because of diabetic, that they were non-compliant with their diabetes or just didn't get educated right. I blame it on the healthcare field, as well, because we've just not been educating our clients to reverse this disease that is extremely reversible, proven over and over and over again. Darkening of skin, armpits. Like, as a nurse, I look at people. Like, I go in, I look at people. I look at your legs. Before you even open your mouth, I have a picture. I look at, dark skin under the neck, belly, all of that. I'm like, I'm already beginning to do a picture just because of what I've seen so often. Um, these symptoms are very evident. Some contributing factors could be the poor diet. Consumption of refined carbohydrates and added sugar can lead to frequent blood sugar spikes, promoting insulin production, and eventually what we just saw was the insulin resistance. When we're not active, that reduces the mobilization of the sugar to get out of the body. Excess weight, well, it's kind of like a loop effect, because you got the excess weight because we've been consuming these things that causes the belly fat. Weight in itself does not, you can be heavier and be metabolically healthy, and you can be skinny and be metabolically unhealthy. Weight in itself is not really one of the things that we can tell whether or not a person is healthy. Chronic stress, because they disrupt those hormones, and even family factors, but mostly because it's habituary. What we've learned how to eat over the years increases our susceptibility to insulin resistance. 90% of Americans are metabolically unhealthy. That's a very, very high level, meaning what we're eating, our environmental factors and things like that. We're insulin 90%. Um, so let's see. So whenever we're looking at how our body is affected by what we're eating, we can't really tell. Some of the things that helps us to be more informed about this is how we feel afterward. We get tired, we get excited, we get depressed even. I always tell a story about my daughter who, when I started learning about this particular issue of insulin resistance and metabolic health, um, she was like, maybe, well, she had to be young because I've been doing this maybe for about a decade. So maybe 16, 17, and she's not that old, but I would say that's about how old she is. She just turned 24, but so maybe 16, 14, 15, 16. Anyways. um so she did this experiment because she wanted to know, because she had been suffering with some anxiety and things, and I'm like, Nia, let's look at, maybe it's the sugar. And so there, if anybody knows those Arizona drinks, tall cans, there's like 56 grams of carbohydrates, but I think it's two servings in that can, two, and it's 56 grams of carbohydrates and sugar. And so she tested herself, and when she did that, she drank this Arizona, and she was like, I felt so good. And then she was like, then I got so depressed. Then I got anxious. And it was just like a showing of what was actually going on inside of her body. She didn't have the continuous glucose monitor to be able to really say your body, your blood sugar just spiked up like this and went down like this. And that's the reason why, because you just rushed your body with so much sugar. Insulin came out to get it, and then it took it down too low. And so this is why mental people with mental health, they go on something like a ketogenic diet or something like that, and they stable right out. Some of those symptoms are gone. But that's for another day. But so this postprandial blood sugar, it just means what happens to your glucose after you eat, especially foods with carbohydrates and sugar. It can really cause your body to do some things, because you have to, insulin is that key to unlock the cell to use the energy. But as we've seen in a few slides before, if those cells are too full, then we are unable to use that energy. Insulin is not, the door is not opening so that we can use it. um so Yeah, symptoms are often the first signal. Fatigue, cravings, brain fog, and stubborn weight. These all matter. Your body whispers before it screams. So symptoms are data. And so we need to know, like, whenever it's not normal. A lot of times, we just don't know how good we feel until we feel better. So even in an elimination diet or elimination, like we stop eating things and we start to bring it back in, we know, like, my big toe hurts. That's weird. So a lot of my clients, I will, it depends on what they have going on and how many symptoms they have, but taking everything back and starting to add it back, we can really get that data and kind of see what is really affecting our body. Um, so yeah, let's see. So most people only look at like the fasting blood sugars, and but what happens after you eat is a much bigger story. So this is where your energy crashes and cravings begin. Um, you don't live in a fasted state. You live in like the after meals, like we're constantly eating. So that's one of the things that we need to learn. Let's see. So, for instance, after eating certain meals, your body does respond in certain ways. So, if you were to eat an egg, this egg is low carb, high protein, and it has healthy fats in it. But it virtually does not raise your blood sugar. It's like a real steady line. and your blood sugar barely changes and it stays mostly stable. And it keeps you full longer without the spikes and crashes. So I'm to slow it down a little bit. We eat the sugar, we eat the high things. For my daughter's example, her blood sugar kind of went up like this, like a roller coaster, but then insulin came to get it and it bring it down. And sometimes there's like a point where it brings it down and it can bring it down too low. And that's even why people that have hypoglycemia or say my blood sugar goes too low, yet they're eating carbs and sugar, and the doctors are telling them eat every 2 hours. That's the reason why, because about every 2 hours your blood sugar is going to go down to a lower number, and it's going to cause that dip and that energy drain and that instability in your mind. So whenever you eat something like an egg, you're going to go, everything is going to give you a little dip, but it's not going to give you a spike like that. So let's see. And then, so compare it to a banana. So like if you wanted to eat a healthy breakfast, you have a choice. I want to eat an egg or I want to eat a banana. This banana has about 14 grams of sugar, and it causes your blood sugar to go up quickly. Your body releases the energy to bring it down, and it could cause a dip. Yes, a banana can be good for you because of the potassium, but there's other ways to get potassium, especially if you have a problem with insulin resistance. The question that I get all the time, isn't honey good? Isn't this good? Isn't a banana good? All of that. Not necessarily if you have a problem with diabetes or a problem with insulin resistance or any of those other disease processes that we saw in the beginning, the high blood pressure, PCOS, low testosterone. These could be affecting your hormones. Um, so this is that was a simple example, but that's why not guessing is the best thing to do. Whenever we can really know what's going on in our bodies, we can be more compliant. Many of us have tried these diets, we've tried different lifestyle plans, and a lot of people will say that worked and I feel great, but they really don't even know what they did and why, the why behind it. And so I have I had just recently saw a patient and his sister said, I'm losing all of this weight, but my blood sugars are still high. And her diet, she was like, I guess she was doing it calorie counting. So she was like, I love my bread, I love my this, I love my that, the bread, the snacks and all of that. And I said, that's why, just losing weight isn't good enough. We need to know what we're doing. We are trying to reset our hormones. We are trying to make sure that our body knows when it's hungry and knows when it's full. And also so with this, um, we're going to be talking about the continuous glucose monitors because this can give good data to say, this is what I ate. If you were to go on YouTube, people use these continuous glucose monitors and they kind of say, I just ate this, it just raised my blood sugar 30 points. Or I ate this and it didn't move my blood sugar at all. Like you can see these examples. It shows exactly what's going on in your body. And you'll be less likely to go back to the way that you've been eating because you'll be able to make informed healthcare decisions. The way I teach, the way I coach, I'm not trying to get anybody to change anything that they don't understand. There, in all you're getting as a Christian, in all you're getting, get understanding is what the word says, and people perish because of lack of knowledge. We need to know what's going on. And this would be a way to know what's going on in addition to the way that I teach and coach and help you to understand exactly what's happening in your body. So a continuous glucose monitor shows the way our blood sugar is responding to different food, stress, sleep, exercise. You don't have to poke your finger. It gives you real-time feedback. It's just that we've seen them, right? Those things on the people's arms, and you scan it, and it shows the number. And Cindy's going to be talking to us in a little while about her experience with it. But some you don't even have to scan anymore. You can just it'll just pop up the numbers. And so it helps to turn numbers into understanding. It's not about tracking forever, but it's about learning your body's responses. So even if you wanted to do this for like 3 weeks or a month or whatever, just to learn, you know, about what's really going on. And it's not for shaming or anything. It's just to give you that good education, that understanding, because we need to, like, it's good to know. And so this is where we'll invite Cindy on, and we'll go back to, I want to spotlight you, Miss Cindy. I can. All right. So, Cindy, you have experience with a continuous glucose monitor, right?
Yes, I am. Hey, everybody. My name is Cindy B. I am using the Libre 3 now. I was using the 2, and it's just a small button. It's on the back of my arm. The Libre 2 was a larger button that I had to literally tap my phone up against to get the readings. But with the Libre 3, I just open the app up on my phone and it automatically shows me the numbers. And it has helped me tremendously because I didn't know until TaShawn told me about my glucose level spiking when I'm stressed. And I had went through a real stressful situation and my glucose levels were really high and would not come down. And it wasn't because of what I was eating, because during that time I wasn't eating regularly because of the stress. And so I was able to recognize that, and I'm able to recognize that now. If I'm stressful, it'll go up. So I do what I have to do, whether it's sit, meditate, listen to music, whatever to calm me down. That's what I do. But with my glucose levels, I'm learning that there are certain things that other people may be able to eat that I cannot eat. It spikes me too much. Like I cut out all of the carbs, the rice, the sugar, the flour, and I in this app you can actually put down what you have eaten and how long it's been so that you can see what is working for you and what's not working for you. Because as being, I don't like saying type 2 diabetic, but my numbers are dropping. My A1C is dropping because I'm more aware of what I can do and what I can't do. So, yeah. There
Yeah,
anything else you
have
want
to
to know about
be,
it?
yeah. I mean, it's completely reversible, but we
Mhm.
have to understand what's going on in our bodies to do that. You know, it is food is a huge, huge factor, but also learning how to you have to get enough sleep. You have to control that stress because it can. And some of it, I mean, even just bumping a little bit, because you can still stay at a reverse level, but because a lot of people have been sick for so long, it takes them a little longer for your body to become it will be considered insulin sensitive again. And so although you're working toward that reversal and you had that setback, it's still not that I'll have this all my life. It's still completely reversible. It still can completely, but paying attention. And this is a tool that will help you to pay attention. Because even before having like, if you would have even gotten like a fasting glucose test 10, 20 years ago, you would have avoided all of this because it's like, mm, these little bumps are more than just little bumps. They're taking me up 30, 40 points. Like, and I'm okay with it. Like I was just watching a video where I think the girl ate something. I can't even remember what it was. Oh, a sweet potato. And sweet potatoes are good for you, right? it went up 60 points. She's like, yeah, I won't be doing that again. I said, well, yeah, it's in the name, honestly. It's a sweet potato. So it is. So there is hope though. Like we want to reverse 1 million type 2 diabetes in my lifetime. And how can we do that? We need to share this information. We need to, I mean, this will be a tool to help people to understand, how can they better understand what's going on inside of their bodies. So thank you so much for sharing that. I guess right. Does anybody have any questions for Cindy? All righty.
Well, hello. Is it easy to put that on your arm? Like, what do you
Yes.
have to do?
Yes, very easy. I clean off the area with alcohol swab, and the Libre 3 comes in one piece. The Libre 2 came in two pieces where I had to stick it together and then apply it. But the Libre 3 comes in just one piece. So I twist the cap off and sort of hit my arm with it and hold it for so many seconds, and you can't feel anything, but it's a little it's not even a needle because it's flexible. When I take it off, it's flexible. So, but it goes in to your skin and it just adheres. It's a, as you can see, it's a adheres around this area. But yes, it's just a one step thingy. It doesn't hurt.
And then how often do you have to change them?
I switch it out every 15 days, and my phone will let me know that when I get down to like it'll let me know. It lets you know, you have 15 days left. When I put it on, you have 14 days. Every day it lets me know um the longevity of it.
Can you hear me?
Hmm.
Oh, okay. I thought I was on mute. Sorry.
Yeah, you're
I
good.
think Dr. Nelson had his hand up. I just seen it on my screen.
Yes, I does the Libre 3 or can you calibrate the Libre 3?
Yes, there is a device that comes with it that you can do a glucose with your glucose as soon as you get it. And I haven't even had to calibrate mine, or I haven't calibrated mine, but you can. You can, and what I like about it is when you do put on a new monitor, if you see a little blood drop by the number, then that means that you should use the device to do your glucose level with pricking your finger so that you can calibrate it again. Yeah.
The Dexcom 7, you can also calibrate. I've been using for a couple of years their over the counter versions from both companies. Well, for about a year on and off, the Abbott, the Abbott makes
Libre.
the Libre. So
Mhm.
the Lingo is the over the counter, and Stelo is the over the counter version of the Dexcom.
Oh,
Unfortunately, none of them you can calibrate. Lingo or Stelo, you cannot calibrate them.
oh, I
And
didn't know.
right now, I was doing a little bit of an experiment. So a few days ago, I put on both, and I'm running 30 points higher on the Stelo than the Lingo.
Oh, wow.
So, anyways, just wanted to share that information.
Usually the Libre is very is it's accurate. So if I have it on my arm and open up the app and it gives me a number, if I were to prick my finger and do it manually, it wouldn't be off by 30 points. It'll still be within like the 5 points of what it said on the app. It's not.
Well, like I said, the Dexcom 7 you can calibrate, and it's fairly accurate. The over-the-counter versions, when I have checked it against my glucose monitor, the glucose monitor was 84, the Lingo was 74, and the Stello on that occasion was 79. So only 5 points different. But then my finger stick was 5 more points up. But most of the time has been in between the two numbers. So one time there were 30 points difference between the two of them, and my glucose finger stick was 50, exactly in the middle, 15 points higher than one and 15 points lower than the other one. So it can vary, unfortunately.
Yeah. So yeah, so you're saying the prescription grade is kind of better to do it than to do the because you said neither one of the
Yeah, the prescription
of
ones you can calibrate, not the Libre 2 or the original. It's only the Libre 3 that you can calibrate. Abbott didn't have a calibration before they came out with the 3.
okay. Okay. That's good to know. Do you find in your practice that having these continuous glucose monitors are helpful?
Absolutely,
Yeah.
because patients can see what the effect of whatever they're eating, what is the effect on your blood sugar.
Yes. Such a good thing to know. And it's such a game changer because now we can get them as clinicians too. Like for me, being a health coach RN, um, I'm going through a company now where we can provide, I can provide this. Somebody was just saying that it's like 400. I know like the over the counter ones are different, but I can provide the prescription grade ones for $99. So it's like we um, are able to do it, they're becoming more aware, and then even asking for a prescription of this being available. So it's good to hear. I think I want to try it as well. I'm not a diabetic or anything, but of course, type 3, the memory. I don't want to go back into some areas and then I get lazy, thinking, oh, a keto track snack or whatever, and then not realizing no, that's the reason why you're tired and sluggish and you don't feel well because that snack has some stuff in it that raised your blood sugar and caused you to have these spikes. So, um, well, did I already do the questions? Okay, so yeah, we do have a Facebook community, Health Beyond Weight Loss, insulin resistance and metabolic health is what it's called on Facebook. And if you want a personal call, you can call us at Right the Vision 22 or you can see my book a call on there. And we will be doing a spring reset starting in March. And I would love for those who are going to join to have a continuous glucose monitor. So I will be letting them know how to get one and as well as how to join. Any other questions? I think that's the end. And then we're
I
gonna.
do have something to say. When I was first given my glucose monitor,
Mhm.
it was not explained to me. It wasn't explained to me um, that I should really. It was just check it. It was
Mm.
just check it. They didn't explain to me, okay, write down everything that you're eating, write down the time, or put it in the app. I didn't even know for a long time that I could even put that information directly into the app because the doctor never even asked me, how's your stuff doing or anything. This is just something that I sort of like figured out. So if people are told that in the beginning, not just to put it on the arm so they can just check their levels, but see what's actually making your levels go up. See what's actually making your levels go down. See what, because mine
Yes.
was it's it was super high in the morning. And remember that used to freak me out. Like, why am I 180 something in the morning and I haven't eaten anything?
And what did
And
you learn? Do you remember what you learned from that when you asked me?
yes, that the liver dumps
Hmm.
in the morning.
The Don
It dumps.
phenomenon. Yeah.
Yeah, it dumps. But also what I'm learning is that I do intermittent fasting. And now that my liver is being healed, I don't wake up at 80 something anymore. Now it's like 150 that I'm waking up at, where for a while it was 180 to above 200 sometimes. But now that I'm doing the different little things to heal my liver and my gut, I wake up at maybe 150, between 135 and 155 is what I'm waking up at now. But my doctor never talked to me about that. So,
That's why it's so important to have someone walk alongside of you because we are failing in healthcare and we're failing in this area to educate our clients. And it's frustrating because we can do better. As a nurse, the discharge planners, I would love to be able to get in there and do some discharge planning education. We're still telling our patients to eat 40, not me, but they come home and I look through their, because I'm a home care nurse. And so I look through their discharge packet and it's still saying eat 45 to 60 grams of carbohydrates 3 times a day with 15 grams of carbohydrates per snack twice a day. And nothing is healing. We can't get well like that. And it's frustrating. And because in the literature of the American Diabetic Association, I can always go back and I can say, hey, can we do a low carb situation for this patient? The problem with the low carb, though, is still the definition has still been too high. And so sometimes I'm, just talking and communicating with the doctors. That's why I offer myself as a nurse concierge too, to be the advocate for the patients as well. There's many avenues I'm trying to take right now as a nurse to help in this area so that I can educate patients or clients and people with disease processes so that they don't have to stay sick. And unfortunately, because it takes 20 to 30 to 10 to 20 years to develop a disease process, what woke me up is the fact that I started seeing people my age, 30s and 40s, with kidney disease, with diabetes type 2, where I wasn't seeing it. It was like average 70 before, strokes, on dialysis, all the things. And I'm like, what happened? But then when you look back and you trace back what we've been doing over the past uh, 40 years, we've been told to eat this big old amount of carbohydrates and sugars, the ultra processed foods and all of the things. And it is, we can see a direct correlation with disease processes and illnesses as we have been told to eat differently. And the answer to everything is medication. Well, and then what we come against as nurses too, my dietitian or my nutritionist said everything in moderation. They mean well, I do believe so, but some people they just don't know because the education comes from pharmaceutical and food companies. Whenever we see uh, um, a conference for these dietitians and doctors and stuff, we always see that they're being sponsored by Pfizer and Quaker Oats and Pepsi Cola. They're gonna not, so if you're paying for my stuff, of course I'm gonna, try to put in some of the things that you all might say, eat the rainbow, everything in moderation, we deserve it, blah blah this. Everybody can't stop and all. Yeah, we can't. And that's the same. Everybody can't stop alcohol unless you stop alcohol. Everything can't be in moderation. Everything can't be, if it's hurting or harming you and you can't stop, then perhaps you have an addiction. And we hate, like, I can tell my patients, go vegan, vegetarian, and they're like, okay, no problem. I tell them cut carbs and sugar. What am I supposed to eat? What am I supposed to eat? What am I supposed to do? And it's like a trigger, like, it's hard because it means your Twinkies are gone. It means, it's very hard, but it's doable. And if we don't kill that demon, if we don't kill the issue, which is addiction, if we don't address it, then we're just going to be in a cycle. And a lot of people will just be like, yeah, I had gestational diabetes. I had the warning signs very early. My body was telling me I was breaking down, but because I'm still doing this thing and I don't have any more symptoms, I'm going to just do what I want to do now and hoping that it all works out. But I believe bringing in a continuous glucose monitor into the practices, will truly help people see the picture. So if I could say two things that I would love to see our healthcare community do in these days and times, I would love to see doctors automatically ordering a fasting glucose, a CAC, which tells about the amount of calcium in the heart, as well as if you have any symptoms that point to insulin resistance, ordering a continuous glucose monitor with the journaling that goes along with it. And I would love to see them put a health coach on every single one, especially if they're pre-diabetes diabetic, which is to me, there's no such thing. You've already started to have the damage. Many people don't understand that the way that they decided that now you're a true diabetic, they looked into the eyes and they finally seen the damage that the sugar has done to the eyes. They look for damage before they diagnose. That means all along you've been sick. They're just looking for that perfect number to see. It's not going to tell the whole picture, but with the symptoms that you have, with the way you feel after you eat, with these numbers and knowing these spikes, a continuous glucose may be the answer for a lot of people to really make these informed healthcare decisions and truly get better. So join me and help me reverse 1 million people with type 2 diabetes in my lifetime. So spread the word. Tell people to join the group. Give them information about this reset that I'm starting, that we'll be starting on March 1st, somewhere in March. I don't know. We'll get there. We're going to start it. And it's also, we're going to offer these continuous glucose monitors. Get on the list, book a call, so that we can see how we can help. I know many people are sick and tired of being sick and tired, and some people don't even realize they're tired. I always tell the story about when I didn't know that couldn't see. It was the driver's license people that told me. And I went to get my eyes tested because I had to renew my driver's license. And the lady was like, you failed miserably in this test for my vision. And because I was in Detroit, they were like, but go ahead, take your license and and we'll make sure you get your glasses. I'm like, so I can go out here and kill everybody on the road because you just told me I can't see. But anyways, that's another story. But I didn't know I could not see until I could see better. And so I would put my glasses on and I would look at like the signs, the street signs and off and on. I'm like, oh my gosh, the difference. So some of us have been living sick for so long that we're used to it. But you never know how good you feel until you can feel better. Don't wait. Don't wait. Don't wait to do something because of the time that it will take to get you to feeling losing the weight. Weight is not even the issue here. It's really your health. Whether you wait or not, the time is going to pass anyways. Let's get started now. And I thank you all for joining us. Remember, the website is www.writethevision22.com. And our Facebook group is Health Beyond Weight Loss, Insulin Resistance, and Metabolic Health. And I thank you all for joining us. Are there any more questions, anything else, any comments or anything that you all want to make before we click off? Anything else?
I thank you so very much for this time because I always get something when I get on with you. So thank you.
God bless. Glory to God. Yes. I'm just out here doing my do, letting my little light shine. So I thank you for joining. I really do. I thank you for sharing your story. So God bless you all and thank you.